Good afternoon, everyone, and welcome to Outspoken with Regina. I'm Dr. Regina Davis Moss, President and CEO of In Our Own Voice, and this is the platform where we hold bold, necessary conversations about justice, equity, and the health of our communities. Because if there's one thing that we know in this moment, awareness just isn't enough. We're here to spark action. Today, we're going to be tackling an urgent crisis. That's Black maternal health. You've heard the statistic many times. Black women are 3 to 4 times more likely to die from pregnancy related causes than white women. But I never like to offer that statistic without saying that the majority of those deaths are preventable. Let me say that again. The majority of those deaths are preventable. So this isn't just a failure of our healthcare system, it's just deep and ongoing racial injustice. So in this conversation, we're going to really be breaking down how we got here, where we are now, and what it will truly take to save Black lives. I am so honored to be joined by a powerhouse panel of leaders. You know some of these people, they need no introduction, but I'm still going to offer that. But these people are fighting every day to protect and uplift Black birthing people. Let's get into this critical conversation now. First, it's my honor to introduce Dr. Michelle Taylor, also known as Feminista Jones, a visionary writer, educator, and activist. She has a PhD in Africology and African American Studies from Temple University. And Dr. Taylor has spent decades serving her community both as a social worker and an academic. She's the author of Reclaiming Our Space, a must read on how Black feminists are reshaping our world from tweets to the streets. She's also the founder of Sankofa Summer School and co-host of Black Girl Missing. It's where she's bringing attention to the stories too often ignored. Please welcome the incredible Dr. Michelle Taylor.
Hello,
Hey.
thank you so much.
Next, I'm honored to introduce our next panelist, Dr. Krystal Redmond, a fierce organizer, scholar, and truth teller that's deeply rooted in Black and queer liberation. Dr. Redmond challenges the systems that harm us, from the nonprofit industrial complex to structural racism in healthcare. And she does so with unmatched clarity and heart. They lead with a commitment to reproductive and health justice that's strategic but also unapologetic. Welcome, KR.
Thank you. Thank you for having me.
And very soon we're going to bring in Angela Aina. She's really busy, but we know she's going to be coming in soon. So I'll come back to her introduction. And during that time, let's just get right into this conversation. All right. So to understand where we are today, we have to examine where we come from. The crisis we see in the Black maternal health community is rooted in this legacy of systemic harm. And it's starting with an exploitation of Black women's bodies in the name of medicine and extending all the way into the implicit bias that still shapes how healthcare is delivered today. Let's talk more about the roots of this crisis and how history continues to impact the present. Dr. Taylor or Michelle, I want to start with you. What are the historical factors that have contributed to the current disparities in the Black maternal health crisis?
Thank you. First of all, I do want to shout out my African American history and culture students who are in the chat, or they should be. I want to shout out to them. We have gotten to a point where we're talking about, kind of these themes, and so I said this was perfect. So yes, let's go back. We're talking centuries of violence against Black women and our bodies. Starting with kidnapping us from the continent and using us for reproduction, right? So there was a systemic and systematic degendering of Black women in the sense that we had to be objects, right? We had to be products. And so that denied us the so-called femininity or the womanhood that white women had access to. And womanhood is protected by men. And so when you render Black women without womanhood, they don't get the same protections. And if their primary responsibility is to produce more labor for this capitalist system, right, there's not really much regard for them outside of what their bodies can produce. They don't care about their health. They don't care about their well-being or anything like that. And Black women were deemed useless if they could not do that, right? So it starts there. And then this idea that, and Angela Davis talks about this idea that Black women are denied the vocation of motherhood, right? That motherhood is something that is reserved for white women because, again, it affirms their femininity and their womanhood. So Black women have always been, chastised. Oh, well, you're neglectful to your children. You don't deserve them. Well, they were neglectful because they were forced to take care of white women's children first and foremost, right? Leaving Black children to suffer and to struggle, but then they were chastised for not being good mothers. And so the vilification of Black mothers became like part and parcel of this American construction of what it means to be a woman. And so over time, Black women have had to deal with people not regarding their humanity, particularly when it comes to birthing and labor and things like that. And so we've seen that happen. We've seen it legislatively. I mean, even things that, it wasn't, I think, until 1969 that it was actually illegal to sexually assault a Black woman, right? Like Black women's bodies have always been fair game and opportunity. We look at the trauma of breastfeeding, right? The fact that Black women had to take their breast and use it to feed white children, which is why we, long-term generational issues and trauma around breastfeeding. We see all of those kinds of things. And then the disparities with the healthcare, which, I know we'll get into later, but just us historically not having access to the same healthcare and affordable, accessible healthcare has led to that. But overall, it is the vilification of Black mothers and this denial of the vocation of motherhood that Black women have had to endure that has led to a lot of this.
Mm-hmm.
Wow. Yeah, you said a whole word right there. Before I continue this conversation, please join me in welcoming Angela Aina, a national leader and one of the architects of the Black maternal health movement. She's the co-founder and executive director of Black Maternal Health, Black Mamas Matter Alliance, and she's transforming policies. She's shaping public health discourse. She's demanding accountability for the lives of Black birthing people. Over 17 years of experience across sectors. She's going to bring the wisdom, the strategy, and the commitment to justice. Angela, thank you so much for being here.
Thank you so much for having me. And I really do appreciate you all's patience because, yes, schedules are crazy these days.
We know you're doing the work. We know you, no apologies needed. We know you're doing the work. KR, let me shift over to you. What are some of the long-standing myths and misconceptions about Black women's reproductive health, and how are they showing up today?
Yeah, thank you for that. I'm going to just tack on to what Dr. T. Michelle was saying and bring us into some of those myths. So, we can't talk about maternal mortality without naming the long legacy of reproductive injustice. I think when we speak of reproductive justice, often folks think it's like cute. It's something fun to engage in, and we're doing this work, which we are doing the work, but it also is rooted in reproductive oppression and the oppression of Black people, Black women, Black queer folks, Black trans folks, Black gender expansive folks in particularly, and from the forced sterilization of Black folks to the experimentation of enslaved Black bodies. And we see this across the board. We even see it now in our healthcare systems. And I say, not just healthcare system wasn't created for us or built with us in mind, but every system. I'm also going to plug, I'm an abolitionist. So I believe in dismantling, disrupting, and rebuilding systems that truly center those that fall deeper within the margins and are within the furthest proximities to power. And in fact, these systems were built on our backs, right? Like our blood, sweat, and tears, and continue to be built on our backs. And similar to what one of the other former panelists had named, is that we see these in our policies, and how it perpetuates harm and hurt for people. And Black bodies have been historically used, again, as subjects of experimental science and medicine without consent, right? And not just historically, but what we're seeing now too as well. Speaking historically of the exploitation of enslaved folks, as Dr. T had mentioned here and such, forced sterilization and operating on folks without anesthesia, because, you know, we were the blueprint for that, right? Or the use and reuse till this day on sales from Henrietta Lacks, and how broad science and medicine has been able to expand because of the suffering and the violence and the denying of our humanity of Black folks, of white folks on Black folks and such, and thinking about how that is directly connected to the colonial imposition that is birthing, that is medicine, that is science, right? And have deeper conversation on that, but how we're deemed as not whole and human, and that leads to what are some of the myths now in science and medicine and just honestly within communities. So the myth that Black people, and especially Black people who birth and Black women, feel less pain. So, you know, this is rooted in slavery. This is rooted in pseudoscience used to justify medical experimentation of enslaved folks, enslaved women. And studies show that Black patients are less likely to receive adequate pain management compared to white patients. We know that. I mean, as a Black queer person, I've experienced that multiple times, and as well as other things related to, you know, my reproductive journey and such. But also, just to name a few others, Black women are inherently more fertile, right? Like we're just fertile. And this is tied to the hypersexualizing of Black folks, particularly Black women, Black trans women, Black cis women, just Black folks. And the origins of this is also during slavery, and how you know, we were auctioned and, you know, poked and pried and things of that nature. And this leads to a delayed diagnosis of infertility, or a dismissal of fertility concerns, while structured barriers to fertility care remain high. And then two more I'll just notice that Black women are strong and can endure more. And this is like from our social dynamics, cultural dynamics, but also in medicine too as well. And yeah, I think that Black folks are deemed as strong because we've had to go through a lot of shit in order to not thrive, but survive, right? Like we understand what harm and violence looks like, and we're always in survival mode. And because of that, we already think 10 steps ahead. Okay, what do we need to do if this moves and that doesn't, you know? So that's engraved in us. But the origin of the strong Black woman or the strong Black person is really rooted in dehumanizing Black folks in general, and devaluing, undervaluing who we are. And that has everything to do with what we see in healthcare, not only in direct medicine, but in mental health care, the devaluing of our emotional and psychological health and well-being, how we're treated within these systems and within communities, and how we're honored. So, and the last one I'll name, as I said before, the myth of just rooted back into Black maternal health, the myth that poor outcomes in Black maternal health are due to personal choices or non-compliance, which really pisses me off. You know, we're gonna go into that more, but like the reality is, like, these inequities in our care, the racism and oppression that is engraved and inherently rooted in these systems, or built from these systems, and these disparities, which is deeper than disparities, but the unequitable outcomes that we're seeing in maternal health are the result of racism. Like, that's it, right? Is the result of weathering, the weathering on Black bodies. That's it. Not individual behavior, not social determinants of health, which I say that very intentionally because I am an adjunct professor in a public health course. And I say this to my students too as well, like the bare minimum, the surface is social determinants of health. Let's say what it is. Let's not shy away from that. And especially as a public health doctor, let's not shy away from that. Public health has also perpetuated a lot of these myths. So it's our job to dismantle and disrupt these myths too as well.
Yeah, I mean, you know, you mentioned your birth story. I want to just lift mine up in that, you know, public health professional, did everything I was supposed to do, had some of the best care, knew how to advocate, and I still was a near miss. So that really does point to the fact that this is not just about individual behavior. And really, if I could just lift this up, you know, because a lot of times we hear this word health equity, but really it's very similar to reproductive justice in that in all those cases, we are trying to make sure people have a fair and just opportunity to be as healthy as possible. And Black women simply aren't getting that opportunity. And it's because Dr. Kamara Jones says this all the time. We are most affected because we are least protected. And that is what we need to do in this work, is to make sure that we are centering the people that are most oppressed. I want to bring Angela in here. KR talked about policy. What major policy decisions, both historically and recently, would you say have contributed to this Black maternal health crisis?
Yeah, so what I want to add to the conversation, and I really do appreciate that Dr. Oh Lord,
KR or Taylor?
Yes, I know Krystal, Dr. Krystal, but
Dr.
I was trying not to call Dr. T. I was trying not to call you Dr. Feminista Jones, because that's how I know you.
But that's what she is.
but you know who you are. Love you to death.
I do sometimes.
Yes. So I appreciate bringing up the point that you brought up before about the act of devaluing our humanity, period, and the role that that has had in just the institution and process of slavery into where we are. And then also appreciate what Dr. Krystal Redmond brought up in terms of some of the policies and how systemic, essentially, reproductive coercion is clearly embedded in every aspect of how medicine in this country is practiced. So the only other thing that I want to add to that is to also bring up the interesting irony, dichotomy, and just challenges, right, that has come up for us in our lived experiences through the centuries in this country as Black women, as Black bodies that have contributed just to the practice of medicine, period, in this country. Going back to even further talking about the whys that why in the world that the powers that be, if you will, decided that, again, because of the foundation of this country and everything being centered on white supremacist capitalism being the biggest one, how our labor practice and the work that we do as Black women also became commodified as part of that process. And herein lies our granny midwives and the introduction of midwifery practice as we understand it, at least on this side of the world. And that being part of the whole reason why they went back and further got captured more people from the continent and brought them over here, in particular, understanding and seeing the capitalistic value behind our labor practice of quote unquote catching babies. So that was also used and of course misused. And then along with, as Krystal Redmond said, the use and experimentation on our bodies to even map out what the reproductive health system even looks like, and the ways in which surgical practices around that is even practiced. It wasn't just Dr. Marion Sims that did that. That was the practice across a lot of physicians around that time. Also in utilizing enslaved Black women as nurses, or what we understand as the practice of nursing. So I say all of this to say that it is, when you look at these historical practices and how it has informed the way we practice medicine, the way we practice surgery, the way we practice services that we know of today as maternity care services, as reproductive health services, is all rooted in Black women's traditional practices around care and our labor work. And then the ways in which, speaking of policy, how policy was then introduced, in particular, the Shepard-Townsend Act back in the late 1890s, that came out of the state of Illinois, which ironically today, Illinois now has the most forward, I would say most forward thinking reproductive health policy, right? it's so interesting to see from a historical lens the ways in which policy has had such a significant impact on our standing and in particular our health outcomes. But even in particular in this case, it was really the Shepard-Townsend Act that really catalyzed the removal of the granny midwife and the granny midwives practices, right, across the South and across the country, and remove midwives as a profession from how pregnancy management, reproductive health care management, and those services that our midwives had, removing it from our communities. And again, commodifying it into a profession that then gets transferred over to doctors, and then later nurses, and then later this system of hospital care, making pregnancy pathologized, I think is the word, and putting it into hospitals. And so I bring this up in particular in this conversation to talk about myths, because when we talk about maternal mortality in general in this country, and this is inclusive for everyone, not just Black women, the quality of care is abysmal. The quality of care is terrible for women across the board, especially in women's health. And that point a lot of times gets lost when we talk about these issues, because really what's embedded in there is a lack of value, the lack of value of human life and how we live, breathe in this country, but then also the lack of value and care of respecting and valuing the practice of a high quality of care, and understanding that we need holistic, full spectrum care that really started off with the midwifery model in order to address a lot of these health outcomes. And this is for everybody. But of course, we know that like for all of the many reasons that Dr. Krystal and Dr. T mentioned, this is why we have these health outcomes. And so still speaking on this point about policy, we can see how the impact of racist, gender oppressive and ultimately of what we call now obstetric violence rooted policies can have such a legacy and impact of even what we have access to now. So now we are in a time period where our policy agendas, for example, I know we'll talk about it a little bit later, where we have to work even harder now just to get basic access to midwifery care, where we have to now do more advocacy around asking doctors and physicians to give us more time. You need more time with your patients during the perinatal or the prenatal period. We need more postpartum appointments to be able to catch some of these syndromes and symptoms that contribute to negative health outcomes, especially what's driving the maternal mortality rate, which is absolutely ridiculous, is the point that I'm trying to make here. And again, while in this country, in the history of this country, it spent so much time, effort, as we heard from our panelists before, trying to devalue Black women, trying to utilize Black women's bodies, but then also at the same time, this weird, annoying thing where they also use our labor, they use our practices to then inform how they do things, and then put financial gains behind that, while also telling us that how we practice and how we do things is not of science, is not of evidence. You see what I'm saying? And so I just wanted to also lift up these things that is their contributors, and to address these myths as well about some of what we know, what we hear in general in mainstream media around some of the solutions, because we know that the solutions are still rooted in our traditions, most especially midwifery care.
Thank you so much. That's a great setup, because we did a great job of looking back. And now I just want to shift to where we are. So Angela, let me just stay with you just a little bit more, because you talked about doulas and you talked about midwives, but specifically tell me why we have found them to be successful in reducing the Black maternal mortality crisis.
Yes, so I want to flesh that out just a little bit more.
Yes.
A few things that because like you, Regina, and or Dr. Regina, excuse me, like
Regina.
you, Dr. Regina, and Dr. Krystal, also public health person, and we know that words mean things, and we have to be very clear about the words and phrases we use. So, as someone who is part of co-founding what is now the Black maternal health movement, I really want to emphasize Black maternal health is not a bad thing. Black maternal health and our freedom is what we're trying to achieve, and there's a practice behind it, okay? And that is still different from maternal mortality. And when we add the phrase Black maternal mortality, just wanting for our audience to understand that we're in particular talking about those specific data points that showcases the disparity of rates and how maternal mortality is more, has a higher risk of experience for Black people, right? But that does not mean that you as an individual Black person, Black birthing person, Black woman, that because you are attempting to get pregnant or are pregnant, that all of a sudden something terrible is going to happen to you. It's a risk factor based upon our experiences and how we are treated. So going back to just lifting up what Dr. Krystal mentioned before, that we don't want to further perpetuate individual assumptions of Blackness. Blackness is wonderful, is beautiful, is great. So with that being said, speaking of doulas and midwives, number one, doulas are totally different from midwives. Midwives are totally different from doulas. We don't want to convolate the two. Doulas are great support companions, right? And doulas come in all different types, all across the full spectrum. Child, we now got daddy doulas, right? So we got all kind of doulas, and we love them, we need them, and we also need for doulas and doula care and services to have higher reimbursement rates. With that being said, having a doula, if you choose to have a doula, and or birth companion or perinatal health worker, the point is these are folks who can help support you and navigate the healthcare system, help support you with throughout your entire perinatal period. And when I use the term perinatal, that's inclusive of preconception period to your prenatal, pregnancy, labor, delivery, and postpartum, that full spectrum. You are likely to have better health outcomes, a better experience throughout your pregnancy, and potentially be able to follow whatever your choices are around how you want to deliver your child or children, right? Whether that's in home birth setting, birth center, hospital setting, what have you. The point is you need a companion, somebody who can support you and work with you throughout your process. These are one of many things that doulas can provide. Midwives, on the other hand, are those professions that are trained and in some cases licensed to be able to practice full-on clinical services around labor and delivery in particular, and can do that in a birth center setting. And then again, if policies allow in the state that you're in, you can do that at home with a midwife, and or typically across the country, we're still fighting this fight here in Georgia, but typically across the country, midwives you can utilize midwifery services in the hospital setting, right? And so midwives have multiple licensures. Nurse midwives, you got certified professional midwives, you got direct entry midwives and traditional midwives. And so just wanted to point out those differences. The point here is that definitely, to the extent that you are able to incorporate midwifery services, doula services in your entire perinatal experience, no matter your pregnancy outcome. Even if you decide to stop the pregnancy, even if there's an unfortunate situation where there's a pregnancy loss, the point is, or the wonderful opportunity to have a great outcome out of your pregnancy. The point here is we see data shows us that there is going to be increased positive health outcomes when you utilize these services, and a decrease rate of cesarean section rates among patients when they utilize doula and midwifery services. Also, thinking of the postpartum period, even if you have mostly doula services throughout your perinatal period, you are likely to have an increased likelihood, should you choose to breastfeed and have a longer duration of breastfeeding your baby throughout the postpartum period for whatever time period fits you. So these are some of those positive outcomes that comes out of doula services and midwifery care and services.
Thank you so much. So, Michelle, Dr. T, I want to come back to you, but underscore what Angela said about maternal health is a good thing. Maternal health is what we want. Black maternal health is definitely what we want. Can you talk to me about some grassroots organizations or initiatives that are leading the charge in maternal health advocacy?
Yeah, but just really quickly on the doula thing, I just want to point out, one, that Project 2025 is advocating for the coverage of doulas in Medicaid and Medicare. And they have a whole section where they talk about the importance of doulas and for low-income families. So I point that out because it's interesting that people, I read the whole thing twice, and I was like, there's some things in there that we've been pushing for. I was like, y'all gotta pay attention because they're thinking about this too. And I of course my eyebrow raised.
And it's all co-option.
Right. It's like, why are you thinking about this? But also, it's interesting, right? So just putting that out there. Also, Virginia University is the first HBCU to offer a doula certificate program, and they're launching that this coming year. And so that's, big thing that the HBCUs are considering that and educating a next generation of that. And it just made me think also of death doulas. I've been seeing more people identifying as death doulas, and kind of when you're talking about the idea that there's all these different doulas that are out there. So that's important. I can list some organizations.
Yeah.
Do we get the opportunity to talk? I'm sorry, I'm taking your whole thing away, but just kind of thinking of the perceptions of things in terms of Black maternal health, if that's okay, because I've long talked about, so I study media a lot, and I've long talked about this idea of the media pushing certain narratives and messages. And yes, we have to talk about the negative experiences that Black women have during birth and things like that. But what I have noticed for the younger generation is that it's leading to them saying they don't have children. And I said, that's by design, right? And so much of the funding that is out there is like focused on like Black maternal health and, trying to figure out, trying to stop the death and things like that. But the messaging that's coming out is like, basically, Black women, if you try to have a baby, might die. And it's like, yeah, you might. You also may have children and become a happy mother. But that kind of goes back again to this vilification of motherhood, right? When we look at what goes viral, how often do you see viral TikToks of things with Black mothers having fun with their babies and having fun with their children, right? You'll see it with the Black dads or other dads, because dads ain't supposed to be parents anyway. So of course that goes viral. And you'll see other folks like the white families get to make all this content that goes viral. But where's the viral content that is just Black mothers loving on their children and really enjoying this vocation of motherhood? So much of it is, upholding this idea of the attitudinal, neck rolling, sassy Black mother who over disciplines her kids and has the attitude and things like that. And all of that feeds our consciousness and how we think about Black motherhood. And so it's either that or it's, let's figure out why so many Black women are dying during birth. And it's like, yes, we can talk about that. But guess what? Many more are living and many more are having children. And so what do we like, how do we get to also make sure that that narrative is put out there? Because we have a generation that is saying, I don't want to have children because I'm scared of what's going to happen. So I just kind of put that out there. I think the messaging is also very important. And in the 21st century, a lot of the messaging that is getting to this generation is that they should not risk having children because it could cost them their lives. And what does that do for our people? Right. But anyway, just put that out there. In terms of organizations, you know, we have the Black Mamas Matter Alliance. I'm thinking of New Voices for Reproductive Justice, based in Pittsburgh, but also does work in Philadelphia. They are very grassroots abolitionist type. Latasha Mays, she's actually in government now. She's really like super dope out there. She had started that, and you know, I can't help but think about Sister Song. I mean, this whole idea of reproductive justice comes from, you know, Sister Loretta Ross, you know, and some of the other women that were also working with that. There's an account I follow on Instagram. I think it's Black Single Mamas Matter or something like that. And like, that's really important to me as somebody who, you know, has been carrying this load. I think that those kinds of groups, they raise money, they give money directly to Black single moms. Like, those things are important too. We can talk about the birthing process, but what happens when the children are here? Like, you know, we want to make sure that we don't fall into the same kind of realm that the pro-lifers do, where all they care about is the baby being born, but not really focusing on what happens after. Reproductive justice is all about being able to have your children in an environment that is sustainable and healthy and happy and all those things. So we have to think about that as well. I'm thinking about the National Birth Equity Collaborative, right? And they focus a lot on maternal and infant well-being. Trying to think of how National Black.
Well, you know what? You know, you just said something. I'm going to put this one out here because there was so many layers to what you have discussed, and I got to ask this question. There's a whole pro-natalist movement right now, right?
Yeah.
They said, I want to have more babies, you know, and the co-optation of the work that we've done, but the math's not mathing, right? Do you all want to talk about that?
Well, it's interesting because they just put out this whole thing where they want to give people $5,000, right? And people are so upset. I was like, but Kamala was offering $6,000, so how is that different, right? The United States understands that it needs children. Like, that's across political lines or anything. The United States economy is not going to survive. We have one of probably the record lowest birth rate that we have right now because the country is not providing you know, the opportunities and access to the care and support that people need to grow their families, right? And so if we're offering people money to have babies, but then not offering the follow-up support, some other countries will support a family for a year. They give them a whole box of stuff. They fill their homes with things that they need. They have parenting classes. Why don't we teach people how to be parents in this country, right? They have paid time off. They have support. They get nurses and social workers that visit and check on them. Supposed to be the richest, most advanced country in the world, and we can't even do that. And we wonder why we have the infant mortality rate that we do, right? And so I think that we need to, definitely I want to see, and this does happen, so I want to see more of it. I would also say the Philly Moms Bailout. So there's a bailout program that raises cash to get mothers out of prison that are, you know, or out of jail that are waiting for trials and things like that. I want to see more of the organizations doing that, making sure that families are getting these love boxes, making sure that there's parenting classes. I'm petitioning. I sent a proposal into Philadelphia because I want to do an Afrocentric parenting class to teach people how to be parents, you know, because when you have that support and people can come and feel like supported and empowered, it's healthier for the babies, healthier for the families, and those kinds of things. So I want to see us being able to do that. I also want to see white people giving us more money to do this. Like, your ancestors are why we are in this situation. It'd be a great idea for you all to fund the initiatives and fund the grassroots organizations that are trying to improve the outcomes for Black people in this country.
KR, you want to jump in on this?
I do. I would also say, okay, so Spark Reproductive Justice now, who I'm the executive director for. I'm also going to name a few other ones, but I do want to bring into the space Kaluntu Reproductive Justice Center. They are a queer, trans-centered birthing justice organization. As well as Feminist Women's Health Center. Kwajalein is the ED there. Sister Love, of course, who's housed with Sister Song at the Mother House, ARC Southeast, Southern Birthing Justice Network, just to name a few. And anybody watching can plug into any of those organizations, including the organizations led by Angela here, and be connected to movement space in the South specifically. But I also want to name that because Spark works directly on the ground with folks who are young, who are not young, who are Black, who are queer, who are trans, I feel like the sentiment around becoming pregnant, making whatever decision they want to make that's best for their bodies, their families, their futures, their communities, isn't wrapped around fear. Fear related to birthing outcomes. It's something that folks hold and understand, if folks decide to enter into that decision, what risks are associated with that. It's wrapped around the shit show of our lives that is this, like, not just economy, political landscape, cultural landscape, the lack of resources. And this is folks that are deeper within those margins, right? They're like, how I'm not even eating. I'm scared to get out of my house because somebody might unalive me. My emotional and psychological safety and physical safety is threatened day to day. Like, if I'm not thriving, if I'm not well, how can I bring another little human being into this world? And as folks on the panel was saying, systems aren't set up for us. As Dr. T was saying, services don't support not just the folks who are pregnant, but afterwards, and children. I'm like, I'll just say real quickly, especially to what Angela said, doulas, are so important. I had my first child was a 27-weeker, significantly premature, spent 121 days in the NICU, had multiple surgeries, has disabilities, et cetera. I had preeclampsia. I'm educated and have resources and such. I got insurance. It still happened, and faced a lot of, things that were just rooted in systemic injustices. Then second time around, a whole other breadth of different health outcomes or health issues happened, and delivered my first daughter, second child, at 24 weeks. And they passed 4 days afterwards because of those deeply rooted systemic oppressions and racism, not just, disinformation, misinformation, it was a lot, right? Again, deeper conversation when we have time. And then on my third go around, I said, you know what? I'm navigating the grief of losing a little one. I want to connect with a doula, a 360 full service doula that targets like death and also other services that helps me restore my emotional well-being. And I didn't even think that I had control over my body in a way that can prepare my body for if I wanted to engage in the experience moving forward. I was already thinking like, that's it. This is it. That's all. And the way that the doula worked with me, and it was a doula community around shifting power and, allowing me to kind of center what decision I would really like to make. And it truly informed comprehensive decision. And then after I made that decision to, try to become pregnant again and birth, outside of my insurance, because, I am privileged to have insurance, but outside of my insurance, I connected with a reproductive endocrinologist, and a lot of people think reproductive endocrinology is all about IVF and such, and it is not solely about that, but also like investigating what's going on with your body, what is going on internally with your physiological health and well-being, and it went into that journey, right? Because of that journey, I hand selected my team, my midwife, and this is all wrapped around privilege. I have insurance, right? And I was able to do those things even outside of my insurance, and had a better birthing experience, not just birthing outcome experience, where I was literally playing like Black music in my delivery. Like, all right, we're gonna really experience joy here. And now I have my my youngest child, who is now 2. So there's that. But so I want to, and that's not the experience of everyone, but I'm bringing that into the space because the conversation around how we can take control over like just our health in general and what that experience can feel like, not just the outcome, but can feel like, and how we build community and power is even engraved in the ways in which we engage people in our own health. So I want to name that, and I forgot what else I was going to name, but yeah, that's that.
Yeah, I think you did a great job of just highlighting not only the failures in the current ways that doctors are being trained, but what else needs to happen and what successful and culturally affirming care can be. I want to just it's 3:45 already. It's unbelievable, but I just want we got it. We went back. We went to the present. Now we just got to focus forward. So you all bear with me just a little bit more because we've got some. We got to wrap up with some action. Angela, rapid fire, are there any other legislative things that we should be know of, we should be taking action on? I'm going to just leave that with you. Dr. Taylor, is there something that we can ask the media to do, or is there a role that media is playing that we should be aware of? And KR, what is one thing that you would like to see immediate change on in the fight for maternal health equity? Angela, let's start with you.
Yes, so I'm going to also circle in everything that was said before, because what Dr. Michelle mentioned about narrative is so extremely important, and is so extremely important with everything that Dr. Krystal shared, even about their experience. Narrative change, and shifting power around that to not only lift up our experiences, to combat the impact of the messages that we receive, and how that shapes decisions, or what we perceive are our decisions, again, are important. And so I just wanted to lift up, going back to what Dr. Michelle mentioned, and Krystal outlined as well, the importance of understanding and getting connected, like you said, Regina, to the organizations that's doing the work. This is in complete spirit of why we founded and created Black Maternal Health Week, because of the very point that Dr. Michelle mentioned. As soon as people heard about maternal mortality, immediately folks got scared. Folks were like, okay, it sounds like I'm going to die anyway if I try to get pregnant, so on and so forth. And that also further shaped the ways in which, especially thinking about the role of media, the ways in which initially the narrative around what policies are needed to address this issue, and what is considered evidence-based. This is why we started Black Maternal Health Week. We wanted to bring visibility to all the things that we said before. The fact that we have the solutions and the answers within our communities is deeply rooted in our cultural practices. God bless you, Dr. Michelle, for lifting up the importance of African-American and Pan-African parenting. So many people have done that as well, and the need to revitalize that again and bring that back as consistent community practices. Lots of great organizations are doing similar things, and a lot of them are part of the Alliance, and were listed out earlier today of what Dr. Michelle and Dr. Krystal mentioned. And yes, of course, shout out to Spark and Feminist and Sister Song and all of our wonderful organizations, and of course in our own voices. And so in terms of policy, because part of even policy change is also connected to the narrative, and the narrative that's out there even in the media, and what's get shined upon as part of the policy change. We need policy change at all levels: the local level, the state level, and the federal level. I started off with local level because local level policies, especially in this current political climate, is going to be the key focus here. And this is for a lot of folks who are advocating and organizing and working with a lot of organizations, and you're trying to work to address and shift change, especially at the health administration and hospital services level. A lot of this is local, especially if you're looking at what's happening in your community around what we mentioned before. And Krystal, my God, thank you for sharing your story, because that also speaks to even just awareness of access to services, right? And what's available to you. These are local issues that can be addressed with engaging our policy decision makers at the local level. They can make change happen now. Releasing funds to support our community-based organizations that provide wraparound services, that provide these parenting and childbirth education programs and services that are rooted in birth and reproductive justice. And we talk a lot about that in BMMA. When we talk about the organizations to support, these are the organizations and the entities that are deeply rooted in birth and reproductive justice and are doing just that, and including providing those support services to our families and parents who are in and out of the criminal justice system, right? Because we don't shy away from that and the importance of that. And ensuring that those entities are also receiving funding and are connected to hospital systems, especially where they serve to meet those gaps in referral services, because that is also a big, big issue. And these changes can happen at the local level. The next level is state. So thinking about, again, those systems, those statewide systems that make decisions around reimbursement and reimbursement rate of services. This is why I keep talking about the importance in further valuing doula services, valuing the fact that we need more birth centers. These are policy issues, especially state level policy issues, because for us in the South, unfortunately, we have what is considered maternity care deserts. And pausing here from a environmental justice perspectives, deserts are not a bad thing. They are needed for our environment, but for the sake of just talking about what desert is used as, but the fact that maternity care services are just being eliminated across the board in the South, that means that we need other alternatives. Birth centers do help to support that alternative, including expansion of midwifery care. And then, of course, at the federal level, we have worked closely with the Black Maternal Health Caucus since 2019 with the creation of the Momnibus package. Is very comprehensive. I know everybody on here has talked about the Momnibus package. It's definitely an example, I would say, of one of many comprehensive federal policies that can and should be enacted to help further drive these solutions in a more comprehensive way across the nation. These are not perfect policy solutions. Definitely don't believe that policy is the end-all be-all to address a lot of these deeply rooted issues, but these are good next steps to get us to that place of what we really want is Black maternal health equity. What we really want is around reproductive freedom and all the things that is rooted in birth and reproductive justice. Thank you.
Thank you. And I'm going to make this plug for people who want to know what they can do. So most immediately, you can call your member of Congress and say, protect funding for Medicaid, HHS, and public health. Black women, 2/3 of Black births are covered by Medicaid. It is directly related to Black maternal health. So we need to protect Medicaid coverage. Michelle, is there anything you did already talk about how media plays a role? Is there anything else you want to add?
Yeah, so my dissertation actually is about Black mothers in cinema. And I developed a theoretical framework for analyzing the depictions of Black mother in film and television, because I was like, nobody's thinking about Black mothers specifically when it comes to how we're representing and how that upholds the vilification of Black motherhood. So things that I want to see different in terms of like interviews and documentaries and things like that. I want to see more poor mothers. So a lot of times we talk to the experts, we talk to the folks who, we think present the best image, when really we need to hear the stories from the people that are living the real stories, and we need to see more diverse stories. I want us to feature more darker skinned women as experts and not just people who are suffering. We do that, right? We position the lighter skinned, well-educated mother as the one we should have empathy for more than the darker skinned woman who doesn't have a high school, education, whatever that is. I just want to see that even when darker skinned women are educated, we still don't put them at the forefront. Again, that upholds the stigma that we have. I want to see us feature more queer and trans parents. They exist. Why are we not talking with them? Why are we not letting them share their stories? I think we need to interrogate how we all participate in media depicting us in the ways that we are, right? So Bell Hooks talks about us having this oppositional gaze. We have the right to criticize, right? You know, as I'm thinking about Sinners, you know, in my mind, I'm thinking about how the mothers are depicted in that film, right? And it's like we have the right to criticize, even though we love something that we're producing, right? Cosby Show, to me, I could go all day on that. But we have the right to do that, and we should do that. And I think that more of us need to get into communications and marketing. We're letting other people tell our stories. We're letting other people portray us. I get that we have Black folks that are involved in these things, but until you have Black mothers helping to design like communications and ads and things like that related to Black maternal health, it falls flat for me, because I'm always about the real, like, first person narrative. The experts are the Black mamas, and that's who need to be centered and whose voices need to be, you know, at the forefront of everything.
KR, what's one thing you want to see to advance Black maternal health equity?
Just one. Let's see.
Well, 1, 2, 3.
Okay, 2, 3. Let's see. I think we already spoke about the maternal health omnibus here. I would like to see a redirect of funding from crisis pregnancy centers, fake clinics, to evidence-based centers that are led by Black folks, Black queer folks, Black trans folks, Black women who are also queer and or trans and gender expansive. I will also say divestment from harmful systems and reinvestment in Black-led, community-rooted and centered and led system, or not systems, but care. And then if I had to pick another one, I would say ultimately, because we spoke a lot here about direct care and medicine, I would say I want to see culturally humble and affirming anti-racist training mandated across every healthcare institution in the country, starting now. And the ways in which like healthcare professionals have to be trained to listen, unlearn biases, to co-create care and plans with Black birthing people, and not act as though they're the sole authority in the room. I always say, like, as a person of medicine, I've always been taught to leave yourself at the door. And I'm like, no, you need to bring your full self into that room, but learn and also be there to understand whose labor is whose to bear. And it is not the patient's or the community's labor to bear in that provider showing up problematic and bringing their mess to the space. It is that provider's responsibility of dismantling, disrupting, and dissecting how they show up problematically and their experiences, and how they can show up culturally humble and anti-racist in order to enact the best level of care for the patient in front of them. So that's what I'll name.
Wow, so much to reflect on. God, you so many jewels here, but unfortunately, this is where we're going to have to pause. Please come back. You know, there's 2, 3, 4 conversations that we can have on of the things we discussed today. Michelle, KR, Angela, thank you so much for being part of today's conversation. We've heard truths, we've heard honesty, we've heard authenticity, and really these things demand our attention, they demand our action. The Black maternal health crisis is urgent, but it is not insurmountable. If I want people to take that away from this conversation, it's not insurmountable, and we can get to Black joy with bold policy, informed advocacy, and community-centered care. We can change this. So here's what I want you to do right now. I want you to follow these organizations, follow Black Women's RJ. These are incredible panelists. We talked about supporting doulas, midwives, and organizations that are doing the work. You heard a lot of them today. Use your voice to demand policies that center Black maternal health. Most of all, listen, center, uplift Black birthing people. Their lives and their experiences matter. They need to trust us. We are our own experts. And also, join us next month for another powerful conversation on Outspoken with Regina. We've got something amazing coming up. You do not want to miss this. Until then, stay informed, stay engaged, and most important, stay outspoken.